firemen down there? Y'all got zoom in? What's that? Y'all were here the other day when the mayor said, I'm in IFB. I'm in IFB right now. Okay. Alex! Wait, Alex. What is that flag? Okay. Right, yeah. Hey, I was wondering. Hey, Alex. Alex! Alex! Alex, we miss you. Alex! Alex! What's up here, bud? God, by the time we can fight you, you're gonna be so grown. What's the difference? What's the difference? Fixing it? Yeah. You guys. Hey, there's a pole right there that we use. You can't reach it. What's the difference in the takes? My reporter replied, she said, hey, you gotta do what you gotta do. Wow, that's all right there. The man that I work together so much, we're almost like husband and wife. Almost. It's kind of like, I'll start saying something and she'll complete the sentence that I'm like, oh. Amanda's a brunette, right? Yeah. She was, out in St. Bernard that's St. John last Saturday. It's either, I tend to work with, at night, I either tend to work with her, Amanda, there you go. It's nasty. By the time we can play with him, he's going to be so much bigger. I'm not doing it. Alex! Yeah, we're going to come this way. What was I doing? Oh, okay. I'll see it. I got your email. Sounds good.
No, she's not here yet. Oh. Okay, copy that. Sounds good.
Whatever you need to do.
Oh, you know what? Let me hold it up there.
Sure.
That'd be awesome.
Absolutely. Check, check, check. Mic check. Does it need to be louder or is the mic good? Okay. Okay.
Just give us a normal.
Hello, good afternoon. Thank you all for being here. It's March 20th.
Yeah, sounds good.
Good? Okay.
Sounds like you're ready to do it.
All right. Let's get started.
Madam Mayor.
No. Hold that thought. I'll go get her.
Hold that thought, man.
Just the one time we don't do it.
Yes. Well, I know it's 2 months when they first started. And 1 week. What did you get on that? Just stood up and go. I didn't get up.
Should what?
Any ideas coming out? We're obviously going to take a lot.
I'll check on that.
Yeah.
At least 5 more minutes, at least 5 more minutes.
I don't have an exact. If I had to guess, I'd say another 10 minutes. 10 minutes. Probably another 10 minutes. I'll let you know something as soon as I find out.
Aaron, just hold us another 10 minutes.
Potentially 10 more minutes, potentially 10 more minutes. Stand by. Mayor's coming out.
My glasses aren't clean. I think I'll be okay. All right, well, good afternoon, and thank you all for being here at City Hall on the roof as we are practicing, of course, social distancing. Let me start by thanking all of our employees, all of our people who have truly been on the front lines of this crisis. From our first responders, all of our healthcare providers, and our journalists who are really working over and above to get good information out there, and we really do appreciate that. And I want to especially thank all of our residents and businesses who have been vigilant in complying with the proclamation that I moved forward with on the 15th of this month. I am issuing a stay home. I am issuing a stay home mandate. It's a guidance document from the health department that takes its legal force from the proclamation that I issued on March 15th, which was Monday, March 15th of this week. We are hereby mandating that residents stay home whenever possible, going out only for critical needs only. We are telling our people and our businesses to stay home. And we've been doing this, but more aggressively is what we are about this afternoon. Across the country, as I've talked with and worked through many of these issues affiliated with this crisis with my brother and sister mayors, again, across the country, we're saying the same thing. The more people who stay home, the more lives that we will save. If you don't have any essential function or cannot safely maintain social distancing, you need to stay at home. We need everyone to pay attention, and we need everyone to comply. Pay attention and comply. Don't look for ways for the rules to not apply to you. Do not look for ways to be an exception. Stay home. If there are any gray areas, err on the side of caution. Stay home. You can find ways to work from home. As they say, move to minimum basic operations. City Hall is changing how we operate as well. The work of the government goes on, and it will go on, but we are moving towards limited functions and operations. Again, we are moving towards limited functions and operations. Currently, I have my directors of every single department evaluating how to provide basic city services to the public, to not close government, but limit our personnel. That's what we're working on and working towards. We are evaluating expanding our civil leave policy. We continue to look at all options to keep payroll moving and keep the city government rolling and also solvent. As I came to you not too long ago, I talked very specifically about the impacts to our operating budget, especially as we relaxed the remittance of sales tax to the city, which the deadline is today. But understanding, relaxing those requirements, it means that we will take a significant hit to our operating budget, which is primarily made up of sales tax revenue. So we're depending on our data and our cash position to determine the steps that we will take as government, but continuing to serve our residents and providing basic city services. As we make changes, we expect businesses absolutely to do the same. Find ways to perform the minimum basic operations and keep people at home. Critical businesses are expected to remain open, which are and have been embedded in the proclamation that was issued. Healthcare providers, groceries, pharmacists, takeout and drive-through restaurants, construction and infrastructure work, banks, news media, all of these are spelled out in the guidance document that we are releasing this afternoon. We want to take this opportunity to thank all of our restaurants, the many of them, for their compliance and for their efforts of doing the right thing, while they're also focusing on keeping their employees employed, providing to-go meals for laid-off employees. They're doing this. Some restaurants have not heeded these restrictions, and make no mistake about it, we have been enforcing, and they're subject to losing their permit to operate in the city of New Orleans. That can go beyond the crises of COVID-19. Complying with these mandates is the only way to help flatten the curve, and we have yet to see our curve. Restaurants are essential services for our residents as well, who rely on them from day to day. We understand that. Industry workers actively performing their duties will be able to travel to and from work, even with the RTA limiting to essential travel only, which is aligned with our workforce. We expect restaurants to follow these guidelines, limit gatherings, and ask guests to call ahead as relates to takeout. Walk-up ordering is not permitted. Don't allow guests picking up food to be congregant, to create these gatherings. We have to take care of our people, and we have to take care of each other. Being mindful of city employees, again, is a part of what we're doing. Therefore, we're moving to limited service. Being responsible with those in our care. And I've been hearing from the advocates, even loud and clear, specifically around our juveniles that are being housed at the JJIC. We are ensuring health and safety of all of our young people, again, in our custody and under our care. We're limiting access to the facility. This has been going on. We're screening our staff and our youth twice a day. That will continue to go on. JJIC is working closely with the courts and defense attorneys to reduce the population of non-violent offenders. Now, I understand that juvenile court has closed, but at the same time, I do understand that this is not good practice as relates to the services that we have to provide our people, and particularly our families. I'm told, and the administration will continue to work with our juvenile court leadership on a virtual system. This was expected to be in place as indicated by juvenile court on yesterday. That did not happen. However, we're going to make sure, meaning my administration and working with juvenile court, to get the services that we need, because it will put a strain on JJIC, make no mistake about that. The full text of the health department guidance is being distributed to the media after this avail. And whoever needs it, of course, we'll get it out there on every one of our platforms as well. The mandate is clear: stay at home. And it means exactly that: stay home. Don't look for excuses or exceptions. Create solutions for your businesses and for our families that keep people away from each other and working from home. I'm going to turn it over now to Dr. Jennifer Vegno, who you have come to know very well as our leader and director of our health department within the city government. So with that, Dr. Vegno.
Thank you, Mayor. As you know, because you've all been following it, our number of positive COVID-19 cases continue to rise in New Orleans and in the state, as well as across the country and world. Within the next week, we are expecting a dramatic rise in cases due to large batches of testing coming back, large numbers of results coming back. We've been expecting this as we expand our testing, and the expansion of testing is a good thing. But these numbers will be very sobering and will continue to indicate what we already suspect, that there is substantial community spread of COVID-19 in New Orleans. The rate of infection here, the rate of cases that we are seeing is increasing much faster than many other cities. That's why earlier this week we took aggressive action through the mayor's order to limit further spread and strain on our healthcare system, and we are strengthening this mandate today with our stay-at-home guidance. For these reasons, as the mayor said, we are mandating that everyone stay at home except for essential needs. This is absolutely necessary to limit contact between people. Do not leave your residence except to fulfill essential needs like getting groceries, go to the doctor, working in an essential service. Do not host gatherings at your home. You can go outside for recreation, and we know we all need to blow off some steam, but do not do so in a group, and do so in accordance with our social distancing requirements. Remember, essential businesses will remain open, so there is no need to rush to a grocery store or pharmacy. For businesses, if you cannot perform your function without touching people, you should be at home. I can't stress this strongly enough. I am proud to announce today that New Orleans was the first city in the nation to roll out a federal drive-through testing pilot program. This is a program led by the U.S. Department of Health and Human Services and implemented by the state and the city. Through the pilot, we have 2 drive-through sites in Orleans Parish, with a 3rd site in Jefferson Parish coming online soon, and fantastic cooperation between parishes and within the state. You've seen field medics with the Louisiana National Guard here on the ground assisting in the administration of the program. Per the guidelines set by the feds, the testing sites will initially focus on our symptomatic healthcare workers and first responders who are working around the clock to provide care, compassion, and safety to our residents. It is our intent that the criteria will soon be expanded to include additional symptomatic high-risk residents. I cannot thank our team at the Health Department, at the New Orleans Office of Homeland Security, the National Guard, the state, the governor's office, everyone in between for the planning efforts that got this program off the ground in a matter of days. That is unprecedented, and we are the first in the country to be able to pull it off. We look forward to doing our part to expand testing citywide. Again, I cannot stress how important the instructions we are giving to you. Every single person plays a role in the health of our community, and the decisions you make today will save lives or they won't. When you do leave your residence for essential services, avoid close contact with others, wash your hands regularly, practice the social distancing we've all been preaching. If you work in an essential service, we need you, and we need you to take precautions to prevent the spread. This is not unfamiliar to us as New Orleanians. We know how to do this. We know how to handle storms. This is yet another challenge to us. Stay home, hunker down, call your loved ones, donate or volunteer to help others if you are able, as we have seen such an outpouring from every segment of our community. We will get through this together. Right now, coming together means staying apart. Think of your healthcare workers on the front line. They're staying at work for you, so please stay home for them. Thank you.
I like that.
I didn't make it up.
No, I like that. That's I like that. And it cannot be overstated how hard our healthcare professionals, the Guard, Homeland Security, have all leaned in to even stand up the drive-through testing sites that opened today at 7:15 a.m. and we got it done in 3 days, and had challenges along the way, as I articulated, but we were able to work through them. And I have to thank our congressional delegation federally who worked with us again to ensure that we not only stood up those drive-through testing sites, but also we were able to be granted flexibility of expanding labs for testing. And so with that, even our partner Oshner, for example, is now able to begin lab testing, and they have the capacity, I understand, to test and to move forward 800 per day, which is huge for the city of New Orleans. So we want to thank our partners in that regard. As it relates to, we call, and I want to say the Sewage and Water Board, I have our Executive Director, Ghassan Corbin, who is with us and who will come to speak before you. I have made it very clear, even in my mandate, and I'll clarify the mandate was issued, the proclamation, on the 16th and not the 15th. But a part of the proclamation in the mandate clearly defines that our Sewage and Water Board employees are on the front lines as well and are considered first responders. Ghassan Corbin will come forward and speak to some of the issues as well as some of the directives that are coming down from the Sewage and Water Board. Ghassan?
Thank you, Mayor. Good afternoon, everyone. Much like the Mayor started her comments today by acknowledging and thanking our employees, I want to do the same. I want to acknowledge and thank the Sewage and Water Board men and women who have showed tremendous amount of dedication and loyalty to serving the public day in, day out. And many of them have reminded me that they've had a lot of disasters and catastrophes and situations much like this or worse than this under their belt, and then they stand ready to serve you as we face this crisis. Today, I'd like to share a couple updates regarding the Sewage and Water Board and where we stand. I'm here to tell you that our operation continue without any major interruption. We are providing drinking water and treating wastewater for every household and business in this city. And with rain coming this weekend, we are ready to respond to that event and beyond. The COVID-19 pandemic has hit home. It has hit our Sewage and Water Board family. We have employees who are quarantined. We are up to 45 total employees who are either tested positive, who are directly in contact with these patients, and out of abundance of caution, we have sent several home just to protect them, keep them safe, and keep the rest of us safe so we can continue to serve the public as we move forward. Our call center and our meter reading departments have been especially hit hard. We are practicing social distancing the best we can and trying to keep our employees from congregating in groups of no more than 10. For our customers, this will translate to longer wait times and far more frequent estimated bills. We know that this will further exacerbate the situations in the future, but this is very unavoidable at this time. We are looking to ease the wait time for our customers by creating an opportunity for customers to leave a voice message, and our staff will get back to them as soon as possible to address their concerns. This may be implemented as early as Monday morning. We continue to do our part, so in addition to our social distancing, we are also disinfecting our workspaces to protect our workers, to keep them safe. Our workers, as the mayor has acknowledged, and thank you, Mayor, for your leadership and support in this, because it means a lot to our workers. They are right up there with police and fire in providing critical services to keep our city safe. We have adjusted our field work to focus on the most pressing emergencies that could cause water outages. Again, our mission is to keep clean water for washing hands flowing without interruption to as many customers as possible. We have had to respond to an increasing number of sewer clogs since the pandemic began. This is avoidable. Please do not flush wipes down your toilets. This may sound whimsical to you, but this is very serious. Wipes clog pipes. Remember that. And we want you to continue your hygiene and wiping your surfaces and keeping your family safe and healthy. But remember, wipes clog pipes. One more update. We have suspended shutoffs, as you all know. We are working to restore water services to delinquent accounts so far to all of our residents so they can wash their hands and practice safe hygiene throughout this pandemic. But at this time, I also want to make a plea to our customers. We continue to provide you with services, and that costs money. And while we won't shut anyone off, please do what you can to support us by paying your bills. This is very, very crucial at this time. You can pay either online or by calling us, or you can put your payment in the mail. This will help us keep going through this very difficult time and prevent you from facing a big bill when all this is done. Thank you very much.
Thank you, Ghassan, for that, and which was a great segue, actually. We, as the city government, are urging our businesses who are still operating, meaning those essential businesses, grocery stores, hardware stores, and the like, to do the best that they can to remit their sales tax to the city because it does have an immediate impact on our cash flow and our ability to provide basic city services. But this is a great segue. I'm going to ask my CAO, Gilbert Montano, to come forth and we'll go just a little bit deeper as it relates to, one, moving government to limited operations. Gilbert?
All right. Thank you, Mayor, and I want to carry out the sentiment. You know, our operations are stabilized through thoughtful and prudent financial management, and that's why we're leaning in so deeply to ensure that the public safety teams are able to operate and we're able to address and combat COVID-19 with as much resources as possible. And because of that decision, we're having to be very thoughtful and calculated with our methodologies on how we're deploying some of our resources. As we said earlier in the week, the city does have a concerning cash position that we're watching very closely, and then a long-term deficit that we'll have to face, as all other businesses will have to face. We finalized some of the methodology and modeling over the course of the recent nights, and if we carry on without having a specific finite period toward where we're going, the city's looking at over $100 million deficit, and that's a significant number that we have to start thinking and preparing for very early. Having said that, as we articulated, both from a public health perspective, but also from a financial perspective, we have to look at going to a limited government operations. It's very different than what we had prepared or thought through hurricanes versus essential and non-essential employees, because we do have and will maintain a normal government operation at a limited capacity. So certain agencies will be scaled down, certainly with both resources and bodies. We are in the process, as the mayor said, having our directors evaluate what that means for the everyday public. Then we will take the next stage moving forward to determine what the next financial decision that we'll have to make as a city and as an organization to maintain a strong cash position in the short term, this temporary period to get us through, but then also as we, in the backdrop, understand where we're going for the overall deficit, and ensuring that we're prepared to meet those challenges, but starting, as we said earlier this week, by a spending and hiring freeze that we did implement. I can't say how vital some of these government operations are in the midst of this period, and making sure we're being thoughtful and wise for this indefinite period is one of the most important factors that we have to maintain. But for financial stability, we will not be able to deploy some of the resources that we are currently deploying. And so we want to really punctuate to our staff and to the public that limited service is going to mean limited service. We are going to have to scale down operations. People are going to have to stay home. We are going to have to make tough decisions moving forward. Now, in the same vein, to the 1,000 employees that we have out there, we are doing everything we can to avoid layoffs and furloughs. There's a lot of financial management tools that we are going to be able to implement. There's a lot of cost reduction plans. There's a lot of different scenarios that we're modeling, that we're dealing with, that we're projecting currently. But I don't want to alleviate the concern that at some point certain decisions will have to be made that may involve those decisions. I think it's open and transparent and fair to be very straightforward with what we're thinking about and what we're contemplating as a final and last resort. Once again, to maintain the financial stability to provide the operations necessary to combat this major issue. That's the holistic perspective that I wanted to articulate as far as limited service. What that means is that most core functions within city government will be operational at a smaller and limited capacity. Everything that you did 2 weeks ago, you should be able to do via online or via phone call. Nothing is going to be completely closed off. It's just some of the external agencies that are currently not activated within this limited service plan that we'll be evaluating to make tough decisions moving forward. And I'm happy to address it through questions. Thank you, Mayor.
Thank you, Gilbert. All right. So we will go into Q&A just based on this stay-at-home mandate. Residents and the like can anticipate increased enforcement. All of our police officers, regardless of deployment, on Monday have been mandated to be in uniform. And we have created various task forces as well, made up of our officers. And Chief Ferguson remains focused and very vigilant as it relates to seeking and maintaining law and order throughout the city of New Orleans. So with that, I'm going to take questions and answers, and we'll do so collectively.